I hear those things about myself, and it doesn't sound very much like me. Someone else must have done all that. I'm only 30. I'm only 30, but I'm so much older than you guys. Whew. It is an honor to be here to give you a convocation speech. And I actually suspect that many of you know very little about me. Those that do know something about me might have been in my research methods class, might have been in the lab I ran yesterday in Psych 101, and so you might have been scared away. But there's a lot to tell you. We could talk about my years singing opera or my love of animals, but I want to focus on my journey in the field of death and dying. Have you ever stayed up late, maybe even all night, trying to understand the concept of death? Have you ever doubted what you've been told will happen to you after you die? Have you ever asked yourself, who am I? What am I? And why am I anything at all? I have. I want to tell you that I'm 30 years old, and all of my life I have lived very closely with death. Some of my earliest memories are of lying in bed at night trying to unwrap the idea that I wasn't going to exist forever. I knew that I was. I knew that I existed. I was very much alive and growing, but very early in my life, I developed an understanding that I would not always be, at least not in this form. This concept was baffling and terrorizing. Imagine being so small that you're learning to walk to school all on your own for the very first time, but possessing the innate knowledge that everything around you one day will fall away. It's a very large burden for a very small person, but I know I'm not the only one who's gone through this. At around age 16, I told myself I was still young, and I gave myself permission to not worry about death for a full year. It was awesome. But at age 17, this anxiety returned. I went to college, death still on my mind, but surrounded by the sights and sounds of Montreal. On my own at McGill University, like many of you, wondering for the first time what exactly from becoming a master of understanding in death I could do with my life and get a degree in. My undergrad experience is another story. I went through all the usual things you might expect me to. I fell in love, I fell out of love. I fell in love with classes, I fell out of love with classes. I dropped out of McGill psychology because it was too hard for me, and I went into McGill sociology where I could write essays. But I made a key decision in my life. I decided that the only way to figure death out was to surround myself with dying people. I wanted to see the process for myself firsthand. Immediately after college, I moved to Philly to complete 2 master's degrees in 2 years. At Penn, I interned in 2 very different hospitals. One was the trauma unit at the Hospital of UPenn, where the number of gunshot wounds streaming through our ER every day was too countless for me. The other was at the Children's Hospital of Philadelphia, working at the very beginning of life in the neonatal intensive care unit, surrounded by loving families championing their newborns to beat unimaginable odds. There were a lot of deaths in both environments, but as a student, my supervisors kept a close eye on me, and I was mostly shielded from getting too close to the process of death. I moved to DC after I received my master's degrees, and I worked in a variety of settings, with adults with brain tumors, families of combat veterans, counseling and providing support to those who were haunted and struggling. I want to recount to you a specific moment when I was working with dying children in Washington, D.C. In the interest of patient privacy, I'm going to change the name of a particular girl I worked with, and we're going to call her Monique. Monique was diagnosed with a very rare form of cancer when she was 8 years old. From that moment, she lived in and out of the hospital, receiving chemotherapy, suffering massive infections, and struggling to survive. I met her toward the very end of her life, at age 12. She celebrated her 13th birthday in the hospital, and that day was the only day I ever saw her smile, surrounded by her sisters, these pink slippers running up and down the hallway, chasing each other on our ward. Monique had been sick for so long that her illness had depleted what little funds her family had to take care of her. She never knew her father, but her mother, who had children by other men, actually took on 2 jobs to make ends meet. Monique's mom was rarely at her daughter's bedside, and I remember walking into her room feeling the profound aloneness of this child. I never knew quite what to say, except to simply be present with her, whether she was feeling better or worse on any given day. I brought her CDs. I tried to do artwork with her. She was just in such incredible pain, and nothing I could do would take that away. So there I sat, taking the time to be with her, so that she knew someone would always be with her. She deserved that. Each time she had surgery, Monique would scream and cry all the way down to the operating room. She was usually so quiet, but with surgery looming, she was too terrified to be silent. One day, she went down for a surgery and was too sick to come back up to our floor. She was transferred to the intensive care unit where she could be more closely monitored. A few days into her time in the ICU, I received a call from her nurse telling me to come fast because Monique was imminently dying and her mother wasn't there. I went to be with her. She wasn't conscious, and I saw her heart rate dropping. I was grateful that she appeared not to be in pain, and although the machines told me that her heart was struggling and failing to keep going, she looked almost happy in that moment. A quiet face, cleaned of all the disease that had weighed her down. A beautiful, beautiful little girl. I held her hand, thought about Monique's existence, my own existence, how she was transitioning into something I couldn't possibly understand. The process of her death, the sounds in the room, the sounds from her body, the machines, all of that is still very clear to me. And yet there was also a deeper experience in that room. Despite what the machines told me, I knew on a very subtle level that Monique's soul had departed from her body. That which made Monique, Monique, flew away from her weary physical form. How did I know? If I thought about it too much, I stopped knowing. But there was a transition from this earthly life to something else, something immeasurable. Her mother wasn't there to see it. I'm not sure how many people truly would have seen anything. But I tell you this story to relate to you the importance of simply being there, being present, and allowing yourself to experience the experiences of others. Moving forward, I worked with many children who died. The hospital even paid for my training as an energy healer for when pain medication stopped working at the end. As a result, I became part of the palliative care team, a special group of doctors, nurses, and social workers who were called in to help alleviate the pain of the dying child. Not every moment of death, if I was there, was as impactful, but I still remember all of them. Remember laying my hands on tiny foreheads and wishing their spirits a safe journey. Some families made it very clear that I was the only person allowed to hold and carry their child after death. What brought me here, though, was the understanding I began to develop of the brothers and sisters who were left behind after these children died. It was these survivors that moved me even further. Specifically, teen brothers and sisters. I tried to understand how they created meaning from death, from the death of someone who had always been there, for good or for bad. There were so many complicated feelings. Not everyone likes their brother or sister. Some siblings resent the attention that a sick child receives. And that resentment can continue long after a death, when parents sometimes become absent due to their own grief experience. What I wanted to know was, at a time where you're just figuring out who you are as a teenager, and a brother or sister dies, or you experience any kind of significant loss or trauma, how do you cope? And does how you cope become who you are? I know my experiences shaped who I am, so I ask, how is your identity affected by how you deal with loss? I would like to invite you to think about that. The opportunity arose for me to get my doctorate at Penn, and this is what I studied. Looking through research on adolescent sibling bereavement, I identified different categories of coping. I called them identity pathways, and this became my new passion and my new purpose. Who are you? How do you define who you are? And is it based on some kind of colossal loss that you have experienced in your life? Think about that. So here I am, from having an intense desire to be around death, to studying how we can live in this body with our painful experiences. I'm here to teach you to look at yourselves, how to exist with resentment, fear, doubt, to know that whatever you feel, however you cope is normal, but there are other ways. Bear witness to your own adaptation. Be there for others. Help them through difficult transitions, but also be there for yourself. Ask who you want to become and strive to get there. As for me, I met and married my true love who brought me into this community. Imagine my surprise to have been a student of death as long as I can remember and to have met Emanuel Swedenborg who went to the other side. And at the point that I found him, to have the knowledge of death and also to have worked in other roles, notably in the field of psychiatry, so that I had a very clear understanding of mental illness. My experience in the new church came to me at a time that I was ready. I was ready to understand that Swedenborg was not simply psychotic or schizophrenic, but like me, he was a student of something far bigger than himself. This isn't to say that I don't have doubt. I too live in this material culture where you gotta see it to believe it. Despite my experiences being so near the depth of others and how I've come to understand grief, I continually question my own knowledge. I don't go home at night and think, okay, everything's gonna be fine, I'll live after I die. Some nights I do. But many nights I think, I ponder about the experience of death and the subtle awareness of the fine line between existence in this world and the next, and how, if I use only my mind, I can't get there. In my life here at the college, I plan on using the tools I've acquired over the course of my education. Practical tools like research methods, and clinical tools like learning to listen without judgment, but also spiritual tools like peeling back the layers of doubt and fear that stand in the way of knowing truth. I'll be working hard to bring empirical credibility to new church beliefs through my research, but I'll also continue my studies on loss and identity. In my classes, you'll hear a lot about my experiences out there in the real world, where there are all kinds of people from very different backgrounds from us. You don't need to be a psychology major to knock on my door. I've shared a little of my story with you, and I'd like to hear yours. I'm here to teach, but also to learn. While I carry the responsibility as a faculty member of introducing you to my worlds, I know that you still live in yours. So know that I'm here. I've chosen to come to Bryn Athyn College, but the path was chosen for me, long before I knew where this place was. Be open to using your mind here, but also your spirit. And perhaps, together, we'll get a little closer to the other side.